We hear it back, and so the recording will occur. And thank you for participating. I'm going to turn it over to Patricia, Craig, and Robin.
Yeah, thank you, Carol. And again, I'm Patricia Hernandez from the Corporation for Supportive Housing, and we are also co-chair of the CAPS committee, which you'll be hearing lots about. Before we get started, I just wanted to launch a poll just to really get an understanding of how many of you folks are familiar with CAPS and have utilized CAPS to get your clients into supportive housing. So you just want to fill out this poll that you should be seeing on your screen to help us get a sense of the knowledge in the room. Okay, looks like for some, this will be new material. So that's really helpful for us to know. So what we'll be walking through is Robin's going to talk a little bit about CAPS, what it is it used for. We will be sending materials afterwards, so don't worry about writing too many things down. We will send that, and then Craig will go through a demo of the system. In the meantime, again, you're all muted, but please feel free to ask any questions in the chat. We'll have time at the end to make sure we get through all the questions and answer them as best as possible. So with that, I'm going to hand it off to Robin.
Thank you, Patricia. Good morning, everyone. My name is Robin Pagliuco. Robin is fine. I'm the Director of Coordinated Entry at HRA, and I'm just going to talk a little bit about what is CAPS, why CAPS, and set Craig up, who's going to actually walk you through the system. So I'm going to, before I share my screen, we in New York City get about $120 million from the federal government, from HUD specifically, every year for homeless services. And so as part of the deal of receiving that $120 million, HUD has a requirement that every locality that receives that money implement a coordinated entry system. So we in New York City, as recipients of that money, are federally mandated to implement this system. But what HUD does is it allows for each individual city or locality to customize the coordinated entry system to fit their needs. And as you all know, New York City is very complicated. We have a lot of different systems, right? And they don't always talk to each other. So what we have been working on over the last several years is what we're going to talk about today. It's called CAPS, the Coordinated Assessment and Placement System. And there are several components. I'm going to walk you through a high-level process flow, and then Craig is going to go into the system. So I'm going to share my screen, and if I could get a thumbs up or something, just so I know that it's happening.
It's happening.
Excellent. Thanks, Patricia. So CAPS, what does the process look like? I'm gonna back up even one step further. We built this system in an existing system, right? As I just mentioned, New York City has a bazillion systems. So we had to choose one. And since this mandate is coming from the federal government around homelessness, we built the system in the what used to be called the PACT system. That's the Supportive Housing Application System. So that's where CAPS lives. So if any of you have done a supportive housing application in the past, you have access. If you haven't, there's a slide that Patricia will share after the presentation that tells you how to get access, but that's what we're talking about. This is a system that lives at HRA in the supportive housing system. So the beginning of CAPS is the Coordinated Assessment Survey. It's simple, basic demographic questions about your client, income, some health questions, and what that survey does, and I'm not going to steal Craig's thunder because he's going to walk us through it. What that survey does is it helps you as case managers or discharge planners engage with your client and come up with a housing plan, right? So you gather information from your client and you complete the survey. It's short, takes less than 30 minutes. And your client will get likely eligibility for supportive housing as well as other housing options. So some of those other housing options are city and state rental subsidies, right? That don't come with any services. Some are one-time payments to help with rent. But what we're really going to focus on today is the supportive housing path that your client may go down. So the user completes the survey, and then they would receive potential eligibility for supportive housing. Again, this is potential eligibility. Your client did not apply for supportive housing yet. They haven't submitted documentation. They didn't get a psychiatric evaluation. They haven't done any of those things yet, right? It's basic questions that they're answering with you. It's sort of the initial engagement in the process.
And Robin, I just want to stop you there just to make sure is everyone aware of what supportive housing is? Or will like a 1-minute answer be helpful? Okay, so just in case, so supportive housing is affordable housing with services. So that's the key. It has wraparound services that are flexible and voluntary for the tenant. And supportive housing generally serves people with chronic homelessness, behavioral health issues, people who are aging, and et cetera. So this is really supportive housing is a good intervention for specifically the folks that you guys are working with on a day-to-day basis. So just wanted to put that out there just in case. It's not like an SRO, but we can get more into that in a little bit, but I'll keep that in mind so we can answer those questions later.
Thank you, Patricia. That's a really good that's a really good call out because I know I personally get very caught up in acronyms and assuming that everybody has the same information. So the user, the case manager completing the survey would receive potential eligibility for supportive housing on behalf of their client, and then they would go on to complete the supportive housing application in the system. This is where documentation is required, documentation of a medical disability, documentation of a severe mental illness, documentation of substance use disorder, right? That's where all of the documentation comes into play to submit the application. And then it goes to us. It goes to HRA, and there's a unit within HRA that makes a determination whether the client is eligible, not eligible, or if the application is unable to complete because we need additional information in order to make that determination. So assuming we're going to follow the happy path, so the client is found to be eligible for supportive housing, and I'm going to pause here for a second. There are many different kinds of supportive housing that serve very specific populations, and each of those types of supportive housing has specific eligibility requirements. So your client may be eligible for only one type of supportive housing based on their clinical issues as well as their homelessness background. They may be eligible for multiple types of supportive housing. And then it's up to the two of you to look at all of the information that the survey does provide, because it will give you descriptions of each category of, I'll call it assistance, right? Of each category of assistance, a description, what's required, next steps, and then who to contact for those next steps. So, a big part of the design of the survey was trying to level the playing field, because there's no way that every case manager in New York City is going to know all of the details of all the different kinds of supportive housing. So this survey is really designed to be a tool to help you make the best decision with your client on what the next steps are. So the client is found eligible for supportive housing, and then the system, this is back-end system work, will make an assessment of vulnerability. And this is also part of the HUD requirement. I'm not going to get into the details because it's very complicated, but as we know, the demand for supportive housing, or really any type of housing support, far outstrips the supply. So per HUD requirements, we have had to make an assessment to try and categorize applicants based on vulnerability. So we went with a high, medium, low categorization. And that does not mean if your client receives a low on the standardized vulnerability assessment that they won't be referred. And again, this is going to get very complicated, so I'm going to gloss over it a bit. With all the different types of supportive housing that exist, there are different pathways of getting there, right? And so the vulnerability assessment is just one of the pieces that plays into how your client will get referred to these specific kinds of supportive housing. So we, and I'm not going to get, I keep saying that I'm not going to get too into the weeds, right? Because it's really easy to do, trust me. And we will talk about this later in the presentation after Craig goes through the system, that once your client has this approval, what next, right? Then what happens? There are multiple pathways to get into supportive housing. It really is based on eligibility for the vacant unit. That is the primary driver of who gets referred to what unit. And then we also consider the SVA, that's the standardized vulnerability assessment, determination, prioritization, because some units have particular categories that they serve, right? Some may only serve veterans or young adults or survivors of domestic violence. And also client choice is a big factor. So I am going to leave it there. And as Patricia said, we will be taking questions in the chat. And we've also reserved time at the end to also go into more detailed questions. I think we have a small enough group that we should be able to hopefully get somewhat into the weeds, hopefully not too deep. So I'm going to turn it over to the esteemed Craig Retchless and let him introduce himself and take you through the demo.
Thanks, Robin. Appreciate that. And I'm Craig Retchless. I'm Assistant Deputy Commissioner at HRA, Human Resources Administration. And I oversee Robin's unit, the Coordinated Entry Unit, and also the PACT unit, which does the supportive housing eligibility review. So I am going to be your demo guy today. I'm going to show you actually the CAP system. We're going to be in a training environment, so that means that there's no client information, but we have a mock client in the system to give you an idea of what it looks like to complete the coordinated assessment survey that Robin just explained to us in her slide, okay? And the coordinated assessment survey is really like what we view as the access point to CAPS, like the overall system. We call our system CAPS now, but we see the survey as the first step, because what it does is it gives the potential eligibility and it starts that process of engagement with your client. So without further ado, let me share my screen and then I can show you how to complete a survey. All right, could you confirm I'm sharing my screen properly?
Yep.
Okay, great. Thank you, Patricia. All right, so as you can see, so some of the, if you don't have access to the system currently, we are going to share at the end of the presentation our user support, and you can reach out to user support and ask to be added, because it's likely your agency is set up in our system. It's very rare that we get a new agency, and we might not have your program necessarily, but oftentimes we even have your program. And so it's just a matter of connecting you with the right people to get you set up in the system. If your program or agency has what we call in our system a system administrator, they would be able to set you up as a new user under the program, the appropriate program. Okay, so I'm in the system. I'm in as a referring agency. And you can see that I have my, this is what we call the dashboard. And so I can do a new survey. And then once I do my survey, it will then also take me into the application. It is required to do a survey prior to submitting a supportive housing application. So just so you know that, that's why there's just the survey icon here. And then you can see here that I can collapse that, open that. If you're a left navigation type of person, you can go do this. And then also there's announcements and training, a lot of good training materials on how to navigate the dashboard, how to complete the application, how to complete the survey, all of that. So, but what we're going to do is we're going to actually do a survey. So let me click on new survey. All right, so I'm in. So as you can see, the first thing that we need to do is have authorization from the client to share information, right? Because this is personal health information. And so to be HIPAA compliant, New York City Human Resources Administration has consent forms. You can click on this. I'm not going to do that for the demo, but you can click on the consent form. It's in over a dozen languages. And what you can do is review the consent forms. There's actually two. There's a HIPAA and a non-HIPAA. You have to have both of them signed by the client for you to then check this button, because you don't have to upload the consent. It's not a requirement, but you do have to attest that your client did consent to share information with HRA, and for HRA to share information back to you as the person working with the client. So then a requirement is that I need to have the date of the consent was signed and the location. I'll put lock file cabinet. The consent is good for 6 months. And so if you sign the consent, you need to complete the survey, and you need to complete the survey within that 6 month in order to go ahead. Now,
quick question. People are asking about verbal consent.
no,
There's no verbal consent, so it needs to
no.
be a paper consent. Yeah, and this is something that we understand during COVID and people are working remotely, but it's something that kind of you guys are mandated, right, to have?
Yes, we have consulted our legal department. We did try to make accommodations for providers, but it was a solid no. And so you cannot complete this survey without having an actual signed consent. Now, I don't want to get too far in the weeds, but if you have like a DocuSign or something like that, some kind of software where the client doesn't actually have to, you don't have to be with the client and them to sign it, and then there are document signing software that you can have the client sign electronically. That is acceptable as long as you have a copy of that and that it is electronically signed and documented by the client. So I hope that's helpful, but you can't do verbal consent. You can't say, well, my client did consent to this, because that is not a record of consent. All right, so I'm gonna do my fictitious client. So bear with me as I do a little data entry. All right. So you see, I need first name, last name, social security, date of birth. And what this is going to do is it's going to, and my client is a male. What it's going to do is it's going to search in the system. So let's hit search. It's looking for a few things. Let's see how we did. So you can see here, I actually did a survey before on this client. So it will pull surveys that were completed within the last 6 months. And so you see, I did one on 3/16/2021. And it gives you a summary of like the different housing programs. These are the supportive housing programs. This person that I did it on before was eligible for CityFAPS and then SSVF because I made the person a veteran. So this gives you a summary here, and then you can actually click on this and get the actual survey that was submitted. So you see, not only is the client consenting that you enter information on them and share it with us, but we're also sharing information back with you from the system so that you understand, kind of the client's history in the system. There's also this link up here we called client documents. And I'm hoping this works. Sometimes this doesn't work in training, but let's see. So the client documents, what it does is, okay, so see, it didn't pull anything. So I'm going to describe it to you. What that does is when we match the client, we're also matching to HRA's document repository. So it's, taking the information from your client, matching it in the HRA repository. So if the client had submitted at some point an application for public assistance and provided, say, a lot of documentation that is required, the system is looking for specific documentation like a social security card, a birth certificate, a photo ID. And why is the system doing that? Well, the reason is because if you're going to actually get your client placed either in supportive housing or even say just they have rental assistance, or maybe they're going to get their own apartment, they're going to need these documents, correct? So we like to have a way to share these documents. Oftentimes in the system, you will get multiple documents like the social security card, and this saves you time as well. So you're not working on getting the client a photo ID. Instead, you're working on what is the the work of getting your client referred and placed, right? So this client also has a very long history of different supportive housing applications here. And so what this is doing is it's showing you what the client was approved for. So in this 10/21/20, they were approved for a family application. Actually, this is listing for the client. And so you can see the referring agency was Canva. They completed the application on the client. And then this red asterisk here says that the application package here would have a housing application. It contains a document that substantiates a homeless episode. So you could go into the application packet and see if like your client had street homelessness or that kind of documentation in a prior supportive housing application packet, right? Okay, so what I'm going to do is, my client was, it looks like they were approved for some categories and disapproved for others. So what I'm going to do is I am going to go ahead. If my client was approved for supportive housing in a prior application, that does bode well for me getting an approval for a new application. All right, so I'm going to start the survey. Okay, so that's telling me I need to look at least one of these prior applications. So I'm going to do that. And as you can see, like this is all the different, documentation. Sometimes having a prior psychiatric and psychosocial is very helpful, because as you know, sometimes our clients can be poor historians, and also they may not want to retell certain stories. So what they're good, this might be good to get like more information, more clinical information on your client. So I'm not going to actually open any of these. I am just going to close this because that was a requirement that I open at least one of the applications. And so let me start the survey. So the system is not only did it match to try to get the client docs that I described, the prior surveys within the last 6 months, and the prior supportive housing applications within the past 5 years, that spinning wheel, what that was telling me is that this is also matching in our system to pull what it's going to share in a future screen. I'm going to show you. It's going to pull homeless information from a couple different systems. All right, so let me orient you to this. So as you can see in the left navigation, I have completed the consent search process. And now I'm going on to the household composition and the veteran status. And so when I do complete something, I get a complete here. And then, if you did have client documents that were helpful in terms of completing the survey, you can always access those documents here. We didn't get a hit on the documents in training. Okay, so I'm going to make the individual I'm helping to fill out the survey an individual. So you see that a single, which automatically populates that there are no children in this household, and this person is the head of household. And then why don't I go ahead and make the person a veteran so I can show you the different discharge statuses. These do relate to whether the person is eligible for certain veteran benefits. And so I am going to give the person an honorable discharge and also make them VA healthcare services eligible. And then I'm done with this page and I go to next. And it's working a little bit here. And so see, I was telling you that it's going to systems and checking and doing a pull of homeless information. And what systems is it pulling from? It's pulling from DHS Cares, which is their system, the Department of Homeless Services, their system for recording homeless days in the shelter system. And so you see it pulls from the singles and families. This also goes and pulls from the HASA system. So HASA has emergency placement units, and so it pulls from that system. And then it also pulls from prior supportive housing applications, homeless information from our own CAP system. And so let's look at this grid. And so you can see that my fictitious client was homeless in the HACA system 365 days out of the past year and 442 out of the past 2 years, and then 624 out of the past 4 years. These are important because the amount of time somebody is homeless affects their eligibility, what type of supportive housing they would be eligible for. And so there is supportive housing that does not require homelessness at all. It's what we call either high service need or SMI, or serious mentally ill housing. But most of the supportive housing does have some kind of either at risk of homeless criteria or actual literal homelessness, like the client must be homeless now and be chronically homeless according to that definition. So that's just a little bit of explanation on why we have this housing and homeless status. So as you can see, it pulled this information from the HACA system. And so based on what it pulled from the systems, it pre-populated the answers to the questions. Isn't that nice? The system will do that for you. Now, that doesn't mean you have to go with the answers here. If you have additional information and you feel that anything that is, no or yes is not accurate, you can change that here. So no, this isn't a DHS client because guess what? This is a HACA client. And so you can see here that that's why that is populated no here. But you can see the different questions that need to be asked for the homeless criteria. And the only 2 questions that the system didn't already answer for me is the last 2. And so it says, has your client experienced eviction in New York City sometime in the year before DHS shelter, or currently in the process of being evicted, or were evicted in New York City within the last 12 months? So that would be related to some rental assistance programs that are available for people who are under eviction or have been evicted. Why don't I go ahead and say yes to that? And then this is a reunification. Like sometimes people have family or friends that they may want to reunite with. And so it does have a result for that. I'm going to say no, that our client doesn't have anyone in mind that could be a good resource for them for their housing situation. Okay, so I'm going to hit next. I have completed the housing and homeless. As you can see, it's giving me the green completed here. And then up here, I have, looks like I'm about a third of the way there. And so then now I'm in the DV and health section. So Robin had mentioned some of these questions that we ask in the survey. So the first question for domestic violence is if they have, if they're a survivor of domestic violence. And then has your client been certified by HRA as a survivor of domestic violence? So that is a process that HRA does to determine, if somebody is experiencing domestic violence and needs HRA shelter services. So I am going to say yes to that. And then you can see here health information. So this is very general health information, right? But depending on what you enter, it will affect the result that you have. If you put no here, like your client does not have any health issues, they will not be potentially eligible for supportive housing, because most supportive housing has some kind of clinical target population that they're looking at serving. And so supportive housing providers may be serving people who are, have the challenge with substance use disorder, serious mental illness. And I do want to call out, we are going to say yes for this client because we want to get some results, right? I do want to show you that like serious mental illness is an actual criteria. Now we have this link here that gives you basically a layman's definition of the OMH criteria for you to think on whether it relates to your client or not. And so this is not the actual criteria, but it's been distilled and simplified so that you could, quickly read this and get a sense of like, hey, does my client have an axis or a DSM diagnosis of, one of the major mental health disorders? And then you can see there's other criteria here. So I did want to call that out as a way, like if you don't know what an SMI definition is, this gives you the layman's terms.
And Craig, we can't see that for some reason, so it might be just the training component,
Oh,
but it will
okay.
come up the text there.
Oh, okay. Sorry about that.
No, it's okay. And Craig, just another question before you move off the screen. So
Yeah.
for the question around, has your client been certified by HRA as a survivor of domestic violence? How would we know that? Oh, Robin literally just answered that as I was asking the question. So
she's
for
answering in the chat.
yeah. So for, I'm
and,
just going to say it out loud, for DV survivors, if they enter an HRA DV shelter, they go through a certification process. A client would let you know if they did or did not. Okay.
Yeah. It would be a client report kind of thing. It's not like we have anything in our system that kind of like flags people like this, that's a very kind of sensitive information. But if your client does share with you the experience that they had been certified by HRA, then you would answer that question, yes. You may have that on a prior survey, but it's something that you need to be, kind of talking with your client about and see if they're remembering that kind of an experience, right? All right. So back to health information. Sorry you didn't get to see the SMI definition, but it's there, and when you go in, you can utilize that. But I'm going to check that my client does have a substance use disorder, and so it asks if my client is participating in or recently completed substance use disorder treatment, and I am going to say no here. Oh, no, I'll say yes, because I want to show. So then it'll ask for the date of last substance use. And so I will say that they've been clean and sober since October 1st. And then I am going to say that the client has a serious mental illness. And then does your client receive Medicaid? I will say yes. And then we'll go on to the next page. It's working. Okay, there we go. All right, so this is the employment income page. And so a lot of times some benefits are, you have to be within a certain income range. For most of the, I would say, clients that we probably are in contact with, or you're probably in contact with, they probably are in the low income band and would not have any problems with being over income for supportive housing programs that have that requirement. But we want you to think about, that if they do have, we're trying to cover all our bases here, essentially. So what I'm going to do is I'm going to say that my client is, you'll see that the name pre-populated, and then all of these asterisks means that I have to answer the question, right? And so I'm going to say my client is unemployed. And I'm going to say that they are applying for disability income. And they do not have employment salary. If my client had an active public assistance benefit in place, the system does do a lookup in our WMS system, and it pre-populates the amount. So what I'm going to just say is they got 214 in public assistance. Do they have SSI or SSD? No, but I said they applied. Do they have veterans assistance? Even though they're a veteran, they don't have any of the, oh, I'll just say no to these. They don't have these assistance. All right. No Social Security, which is retirement, no pension and retirement benefit, no unemployment, and no other compensation. So this question is really about making sure that if there were other people in the household that were going to be living with the client, their income would also be taken into consideration. But our person is an individual, so there is no other income. So what that did was that completed the form. And the as you can see, it's complete over here. And then it gave me a wonderful summary here of what I had entered. And so the employment status, the source of income, and it even recorded here that my the individual I'm working with has applied for SSI and SSDI. And so their total household income comes from their public assistance grant that they are currently receiving. And if I wanted to go back and change this, I could hit this edit button and it would take me back to the form. But for time's sake, I'm not going to do that. I just wanted to call that out for you guys. Okay, so I'm done with employment and income, and I'm going to the next set of questions. Now, I always frame this as these questions can be a little thorny, like actually asking your client some of these questions. They may be off-putting to the client. And so it is something that you'll have to gauge whether you want to ask these kind of questions of your client or not. And it's the only questions that we put unknown here. And so, if you chose not to ask these questions, basically you could check unknown, which would act as a no to all of these. But you should know that there are exclusionary criteria for being offered many types of supportive housing, particularly congregate supportive housing has federal funding in the congregate program. And these are exclusionary criteria for those federally subsidized congregate programs. I'm going to say that my client does not have, has not been evicted and does not owe any money, lifetime sex offender, meth production, convictions of violent crimes, or committed fraud, bribery, that kind of thing. These are all coming from federal requirements to exclude certain people from housing. So, so I answered no to those, and that would complete that section. So I'll go to the next. All right, so this says that this pre-populated because it showed that I had a prior approval for New York City 1515 for adult. And so then you can go down the list of other housing. Sometimes people will come to you and they will have a housing choice voucher, like a Section 8 voucher. It's very rare, but it could be that they have that. And so we put it in here so that you would get that as a result in the survey, so that you would know get the description and what to do next, and has some resources available. But generally, I would say the vast majority of clients do not have any kind of subsidy in place. And so you may be checking no to this, but it already pre-populated with the prior approval. So I'm going to go with it. And then I'll hit next. So this is important. It asks, are you ready to finalize the survey? A lot of people ask, do you have the ability to edit the survey? And the answer to that is no, once you finalize it. So I could say no to this and then just save it. And then it would be in my pending survey queue. See the pending survey over here in the left navigation? Maybe I'm not sure about something. What I would do is I would just save it. It goes to pending. I can complete it later. But once I finalize the survey, then it is the actual survey that I have completed on my client, and it becomes the record. It doesn't restrict you from doing another survey. Say you feel like you made a mistake on the survey, and you were expecting a different outcome. You certainly can do another survey, or you can go with the survey that you have. But once you finalize it, and I'm going to say yes, then it's going to ask if I'm really ready to finalize it, and I am going to say yes, finalize it. And then you can see the results that I get. So this is all the housing programs, and Robin had mentioned, she said, you're as a case manager, as a caseworker, maybe you're not familiar with all the different types of supportive housing. So the way I completed the survey, my client was eligible for a lot of different supportive housing programs. As you can see, the type of program is here. So they were not only eligible for SMI, but they were also eligible for New York 1 and 2, New York 3 Pop A. And you see it has a short description of the population underneath, which is helpful. And then because the person I filled out on had also a substance use issue, that also came out as potentially eligible for New York 3 Pop F, and it goes on here. And so some of city perhaps came up because I had answered that. I was under threat of eviction. The SSVF program came up because I said I was a veteran that was honorably charged, and also the VASH program, which many supportive housing programs have VASH funding. So that's good to know. Now, these are all potential eligibility, right? So that's not to say, that this is determinative, right? It's not actually determined. It's really a tool for you to use with your client. And so maybe you talk with your client and you agree you would like to go and refer the client, help them work on a housing plan for supportive housing. So then here you see you would need to, for Pop A, complete the 2010E, or the supportive housing program. You'd have to attach the psych eval, also a psychosocial. Then it gives the how to connect with the CAPS program. And then it also gives technical support. You can see it has our technical support line, and but we're going to share an email with you that that's what you would contact. And then also support from CUCS, which is a nonprofit agency, also does a lot of supportive housing, referral and placement, training and technical assistance. So we listed them as well. So because I already know that my client wants to pursue supportive housing, I can then go to this green button here and start a supportive housing. If I wanted to view this survey in a PDF, I would click on this. I'm not going to do that for time's sake, but just to know that you can view it in a PDF file, and then you can save that file so for sharing with the client, printing out, and so on. So let's go ahead and start a supportive housing application. I just want to show you this function, but we're not going to actually complete an application because it takes quite a bit of time. It takes about an hour. That's what we've been told by users. But if you're more experienced, you may complete it in less time. And as you can see, it's asking that you verify that you have gained consent again, and then you can see it pre-populates the client information that I populated. And in the application, it pre-populates some of the other fields as well for you based on what you filled out in the survey. So then I can go back to my my dashboard, and I can go see I have submitted surveys. So I had just submitted this one, and you can see here for 2021. And so here I have the PDF. I didn't actually start the supportive housing application. So you can start it here from your submitted surveys. You can open the survey form. That's everything that you filled out in terms of the questions on the survey and the results. So that is very helpful to have that type of documentation. And then, like I said, if you started a survey and saved a survey, it goes into the pending surveys and you can go back to it. And then also there are housing resources that we have listed here that will, here you can open the SMI definition. That's the actual criteria. And then there's other things related to maybe you don't know about the City FHEPS program. So we have a FAQ here that you could review and learn more about that particular program. So we're trying to be very helpful here in terms of, things that are in the system that you may not have extensive knowledge of. And so I'm going to just open it up. Is there anything that anyone wanted me to show again, or are there questions that I may need to illustrate? Otherwise, I can stop sharing my screen and we can go into our question and answer period.
I think you can probably stop sharing.
Okay.
And then we can do QA. I have a question. So let's say I'm case manager in an organization. My client's eligible for supportive housing. I do the HRA 2010E or the supportive housing applications. We use it interchangeably, but it's called the supportive housing application, and they get approved. So there's an approval. What do I do with that application? How do I actually get it into the hands of a housing provider?
Yeah, so it depends on what you're approved for, right? And it depends on where your client is living. So, if I have a client who is, say, like my client was living in HASA emergency housing, right? And so they have a referral and placement team that does referral and placement for people who are in HASA housing, right? So that would be and in the determination letter, it's going to have the person who is the housing placement person on the determination letter. So that should have been the first thing I said, is that once you have your eligibility, you'll know the eligibility by looking at the determination letter. It tells you what you were eligible for and what you were not eligible for, right? So to continue to answer your question, so if my client was not in a HACA emergency setting, maybe maybe they are in a treatment program, like an OASIS licensed treatment program per se. That would be for the program, whoever is working with the client, it could be a care coordinator in this instance, where they would see what the client is approved for, and then CUCS puts out a vacancy listing for certain types of supportive housing, and you can apply directly to certain programs. They have a list of contacts for intake people. If they are approved for a mental health category, they would be eligible to go through the CUCS SPOA system, which is the single point of access. And that's why we have the link to SPOA, so that you guys can see, like, you know, or the link to CUCS, so that you would have that resource to apply your client who is eligible. If your client is in the hospital, that is also a mechanism that people utilize, is the SPOA system. If they are in a DHS shelter, there is another team under HRA that does referral and placement for those individuals. So it's not the same, you know, depending on where your client is living, it's not the same referral and placement system. And I hope I'm conveying that clearly. And so if you're not in the DHS or HACA emergency housing system, then likely you are, as the referring agency, as the person who submitted the application, it would be your responsibility to assist your client to find the appropriate housing and apply them directly to the program.
Yeah, that makes total sense. And somebody just, and I put in the chat kind of CUCS's vacancy list, so you can just see how it looks like.
Yeah.
And then Michael wrote, so if you do a SPOA, CUCS will give you about 3 organizations that might have openings. So they will kind of help navigate what the person is eligible for and what vacancies there are out there.
Yeah, they'll, my understanding of it, I haven't been in the system in a while, but my understanding of it is that it guarantees your client an interview with a supportive housing provider if they are SPOA eligible, right? So they go through that as well. But part of the SPOA eligibility is sharing your approved HRA packet, your supportive housing packet. So all of the materials that are generated as part of you know, applying and being eligible for supportive housing, and you will see it in the system. That all goes to CUCS as part of their SPOA process. And then that they have I think they have a very kind of like brief sheet that needs to be completed on top of the all the HRA supportive housing packet materials.
And, you know, kind of understanding our clients in the community, sometimes it's really hard to get those documents like a psychiatric evaluation or psychosocial. It's really challenging. Can you guys talk a little about the changes you've made to enable that process to be a little bit easier for people to get that?
So yeah, so we've expanded professionals that can complete the psychiatric evaluation. And sometimes people who were completing supportive housing applications years ago, they know it to be like very strict. It has to be like a licensed psychiatrist or a licensed psychiatric nurse practitioner. You know, like, so it used to be a very narrow profession that could complete the psychiatric evaluation. And now we have a whole list. And if you could share, I could send you the announcement of that list. And if you could share that with this group, that would be great, Patricia.
Yeah.
Because I think it's important for them to know that even an LMSW with a sign off of an LCSW or another licensed professional can now complete a psychiatric evaluation on the client. So oftentimes it could be you have somebody who's doing care coordination or some kind of service provision with your client, and they are connected with a licensed social worker. That person can complete the psychiatric evaluation now. So I feel like that really expands the possibilities and reduces the challenge of obtaining that documentation, because for a number of reasons. One, you have more professions that can complete the actual assessment. Two, sometimes it may be that you are the social worker, the licensed social worker submitting the application. You could actually do the psych eval on your client. You know, so that is something that could really expand the possibilities of having all the documents you need, because that can be a challenge. Now, I will point to also CUCS does a guide on how to do a thorough, comprehensive psychiatric evaluation. So you would see that on their website as well. And so like if you're a licensed social worker, but you really don't have a lot of experience doing a psychiatric evaluation, like the format of it, there are guides to help you.
Yeah, and I always find that's kind of the hardest thing, right? So, you know, if your organization is going to really embark on making sure people get into supportive housing, learning how to write a good psychosocial that explains the needs of the client, but also their strengths that allow them to
Yes.
live in the community. So I would really recommend working with CUCS on that. There's
Yeah.
a question in the chat.
Can I
Oh,
just
yeah,
piggyback on
go ahead.
that, Patricia? So this is an issue in terms of documentation when we receive the supportive housing application. Oftentimes, people will accentuate the challenges of the client. And it is important to be straightforward in describing what are the needs of your client that you're working with. But you do need to have that balance of like, that is not all they are. We all know that. I used to work with clients. I don't now, I don't have direct client contact now, but I did at one time in my profession and in my career. And you have to tell also the story of the client, their strengths, their supports, who is in their life. A lot of times people will really just hone in on all the challenges that the client has, and it really doesn't do the client justice in terms of painting the whole picture. So I do like to emphasize that if you're going to write either a psychosocial assessment or a psych eval, please do it from a strengths-based perspective for your client. And please tell a story of your client. Don't make it all about what their, you know, what their mental health diagnosis is, or, you know, their what they were diagnosed in terms of their substance use. You know, make it about them and their hopes to have an independent life. Make it about that.
That's a really good point. Someone in the question asked, so besides CUCS, what other providers are there for supportive housing or 2010E? So there's a ton of organizations that operate supportive housing. What CUCS does uniquely is that they help you kind of navigate which organizations have openings, but they are definitely not the only organization that have supportive housing. A ton of them really do. And again, the CUCS vacancy list can name some of those organizations that have openings. So you can go directly to that organization, or if even in your own organizations that you might operate supportive housing, being able to work with that person directly. So anything you want to add on that, Craig or Robin?
No, I think you covered it. The vacancy listing is really a good start, and you start to get a sense of what are the different agencies that have the different types of supportive housing. And of course, you're going to hone in on those that your client is eligible for, clearly. And then you need to do the process of, getting the housing application to that provider, either directly, or if you're going to do the SPOA, you would do it that way. That then CUCS would be, assisting you in that way. But if it's your task to assist the client, you would find the agency that has the right supportive housing program, and you would directly share the housing application with them, and then be in touch with them. It may require some follow-up with that agency. Just sending it off is not going to be effective in this in this situation, in this scenario. Be proactive with the agency to see if they have vacancies, and if they will, where your client is at in terms of the possibility of being interviewed for a vacancy.
Yeah. Craig, do you know how often the vacancy list is updated from CUCS?
I think they publish it every 2 weeks.
Yeah. And, of course, there might be occasions, it's happened to me, where I'm like, oh, it said you have a vacancy and it's not there, which is why
Yeah.
kind of Craig is like, follow up with the organization.
Yeah.
And I would also recommend, so I don't know if you guys are aware of the Health and Housing Consortium. So we have one in the Bronx and Brooklyn, and they're kind of a membership organization that collaborates with city government agencies, hospitals, social services, and housing providers. And they do this thing called a housing marketplace, where you just get to know the supportive housing providers to really kind of develop that relationship. So if you do have clients that, are eligible for a particular program in that organization, you kind of know who they are. You built that relationship with. So I really recommend, kind of starting those relationships with local housing providers, especially if you have a large population of clients with SMI, for instance. Like, who are those supportive housing providers that have those beds available, and really kind of get to know their intake person. It could be really helpful.
Yeah, and I would just add, Patricia, this is not easy. This can be very challenging. And if you are experiencing that, it's not you. It really is the system, because for some of the supportive housing categories that your client may be eligible for, there may not be that many programs available to them. And then, New York City is a large city, and there may be a lot of people who are eligible, who are also looking to, be placed in that type of program, so it can be frustrating, but I do encourage people to be persistent and advocate, because that's the best way that you can get a placement for your client.
Yeah.
And the best way for that kind of positive outcome.
Yeah, and you were answering someone's question without even knowing it. So many times the client qualifies for category F, which I found really
Yes.
has limited availability. What choices? So kind of to what Craig says, sometimes just there's not enough vacancy. This is kind of what we do at CSH a lot of, like really advocate for government to have more housing available for particular vulnerable populations. We help with people to develop housing. We do technical assistance for them to operate housing. So really to increase that supply, because we know there really isn't enough. So we're always looking to that. So even if kind of your organization, sometimes we get organizations that serve a high population and that also need housing, and they become supportive housing operators themselves, right? So if you have large organizations that you're interested in learning more about how you can operate supportive housing, there are opportunities for that. And you can always feel free to contact me at CSH. And then please, Michael, this is a good point, Michael, please mention that the paperwork must be current, psych eval and psychosocial within the last 6 months. Is it within the last 6 months?
Yes.
Yes, right? Okay.
That is still the case. That is a current psychosocial or psych eval. The other thing I want to mention is that if you do get an approval, this is a little bit of old news, but it may be new to some people. The approval period is for a year now. And so it used to be actually way back when it used to be like 3 months. And then HRA went to 6 months. And now we have extended the period of time to 1 year. So that gives you more time to work with your client on the referral and placement process.
Craig, a question. If there is, let's say I'm starting a new application and there's already a psych eval in there from another organization that was completed and within 6 months, can I use that for my current application?
I would not advise that. I would use it as a way of knowing more about my client.
Information gathering.
Yeah, and knowing like that they had maybe they were seeing a licensed professional at that time that completed that psychiatric evaluation. I would, go to that if they were still engaged with that professional. I would go to that person and ask them for an updated psychiatric evaluation, because that would be more ethical to do it that way.
And that's the benefit of CAPS. I always have to say this, like I used to do 2010s like almost every day working at Bellevue for my clients. And you don't even understand how many times I've done an application and there was already 3 other ones that were active. Like this is the benefit of CAPS, that it tells you already if there's information. It tells you, it kind of gives you that little background for the client that can be really helpful and help you not duplicate efforts.
Now, I will say that if you have an active approval on, like, if I, like, how I, at the beginning of the survey, it showed the prior supportive housing, application activity that it matched the client to. You can act on an active approval for your client. They gave you permission to. So the whole housing packet, if they have, say your client was eligible for, say, New York 3 Pop F, and it has 6 more months on the approval period, you can use that packet because the client gave you permission to do that.
Yeah, that's a really good point. And as a workflow piece, if you guys have clients that are in and out the hospital, that is such a good opportunity for that social worker to start putting the pieces together for the application, because they might be able to get that psych eval and psychosocial. And then when they're discharged, you can take that over, right? Once they have that approved, you can really work on kind of the placement, the interview, all those pieces. But really trying to leverage when folks are in the hospital is a good thing. And I think, oftentimes the hospital social worker is like, well, I can't do housing because it really extends beyond the walls of the hospital, but they can start the process, right? Get them a psych eval there, get them a psychosocial there. So when the person is discharged, you already have gone pretty far and you don't have to start from scratch.
Yeah, and so anything that is transmitted to HRA is in that section, even applications that were unable to complete and disapproved. Those we feel like is good information that could be utilized in engaging your client around, completing the picture of their situation that they're in right now, right? And so the supportive housing application history goes back 5 years. This can be very helpful, like you're saying, Patricia, when you're having to do the application to have that information available is an excellent resource for the worker and for the client, because sometimes the client is not really remembering that they had an application at one point. Maybe they know it as something else, it does help to clarify things, I think.
There's another question in the chat. So the acceptance letter has a different person than me. What do I do so that the responses are coming to me and not the person on the letter? Oh, so I get it. Like if there's already an approval and it's approved by, can you talk to that, Greg?
Yeah. So you would definitely, if you're sharing with somebody, you are definitely going to be letting them know that, you are going to be letting them know that, you're probably going to have to provide some kind of cover sheet. This is really getting into the weeds, but that's okay. But like when you're sharing that application packet, you would need to have your contact information and your capacity that you're working with the client, and say that, we have this approved housing packet and we are going to be using this, but I am the contact person for the referral and placement process for this client. You're going to have an explanation. You can't just cold, send something that was done by another agency. It's okay for HRA to share that because the client consented for us to share it with you, the new agency, but you in the referral and placement process, you're going to have to identify yourself formally as the person who is helping the client with the referral and placement process.
Right. Yeah, and Jillian just echoed that exactly what you said in the chat as well.
Yeah, but they should accept the packet because the approval period is still active.
Mm-hmm. So somebody asked about how does one link up with the Health and Housing Consortium that I mentioned? So there are a membership. So the Bronx part of the consortia is a membership. So your organization can become a member for a nominal fee and attend all the trainings, but you can also look at their site and they have free events for the community as well. I will add, or actually when I send out the slides, I'm going to send you guys the information from the consortium so you guys can look into that and see whether your organization wants to become a member, or if you just want to kind of, be on their listserv to learn more about events that they're putting out in the community. Another question, if a packet has been sent back for a reason, how much time do I get to submit what they needed? So to resubmit, whatever documentation.
So so in our system, you should be receiving an automated email that you have a determination in the system. So you log into the system, that's when you find out, whether your client was approved or not. If they were not approved, and if they were made what's called unable to complete, oftentimes there's a note that states like what clarification the reviewer is looking for. And so if you're able to, like, say something is missing from the psychosocial, so you amend the psychosocial, you can resubmit that application the next day. Now in the new system, you only have once that unable to complete comes back to you, you only have 30 days in order to respond to that. If you don't respond to that, you're going to lose that application. So you need to, you'll lose the ability to resubmit it. So when you, this is a little bit in the weeds as well, but when you resubmit an application, we have a function that copies over all the information from the unable to complete application to the one you're resubmitting. And so you don't have to do the data entry all over again. You can always submit the application again, but I'm just trying to let you know, like, you have a 30-day window to get that, have that resubmit function available to you. So that will save you time. But you should be able to respond fairly quickly to whatever it is that the reviewer is requesting, and clarify that. And you can always contact the reviewer as well. You can email or call the reviewer if you don't understand something on the determination letter. They will get back to you. They usually get back to people either same day or next day. The unit is very responsive. So you should get some word back from them, because really the objective of our unit is to have a complete application, whether it means complete and the client is approved, or complete and the client is not eligible for anything or disapproved.
Yeah, and Latoya just mentioned in the chat that they've contacted a social worker who's reviewed the application, has been very helpful in discussions on how to address what was wrong or why the application was not accepted. So they will provide some guidance. And Mike also mentioned sometimes the psych eval is not comprehensive enough, and that might take some time to get. Yeah, I mean, I often find that's a big thing. So especially if you're sending your client that you know really well to like a psychiatrist that meeting them one time, they're not going to get the whole picture. So I think it's really important to be able to kind of supplement a lot of that with what you're writing in your psychosocial, those kind of things.
Patricia, I just want to emphasize that point, because that really is the best thing you can do for the packet. And when you submit, if you realize, like, okay, this psych eval is rather what I would call like bare bones, not a lot of information, but it has the essential elements of a psych eval. You really should supplement that in the psychosocial. Fill in the gaps. If you have a really complete psychosocial, you may not get that, if it's a very, very comprehensive, unless something is that's vital, that's missing in the psych eval. Oftentimes they will not say the psych eval is not comprehensive, right? Because they're getting the information from the psychosocial. So it's both of them together. That's for the mental health categories, right? Also, I should mention that not all categories require a psych eval. The substance use categories do not require a psych eval. It's only when you're applying for the mental health categories. That's when you'll need to submit a psych eval.
Okay. We have like a couple of minutes. Any last minute questions, or somebody wants to, come off of mute, let me know if there's anything you want to share or add. If not, I think we can hand it off to Carol for just to close us out.
So thank you very much, Patricia, Craig, and Robin, for your overview of this program. We hope it was informative and is helpful, and we certainly will take any type of questions that you might have if you send them to us. We're happy to be the conduit to work with Patricia, Craig, and Robin and learning and following up. And I know that the recording and the slides and information will be made available, as there was a lot of information presented in a short period of time, and it's the start. So I thank you very much for your participation. I'd also like to, on this call, introduce Deborah Rose, who is a member of our AHN RHS team. Deborah joined us. Deborah is knowledgeable of the system, and as a member of our team will also be a conduit and assistant in receiving your questions and helping be that liaison as we go forward. So yep, Deborah's there. She can wave, and you'll see her on the frames here of all of the participants. So thank you.
Awesome. Thank you, everyone. And like we said, we'll send information out. I'll have our contacts should you have any questions. But also, once you get into the CAP system, like there's so many like training materials there that can answer all the questions you have about the actual system. So hopefully that would be helpful. But thank you, everyone, for joining today, and be on the lookout for a follow-up email. And thank you, Craig and Robin. Really appreciate it.
Thank you,
Absolutely. Thank you
everyone.
all.
Appreciate
Thanks.
it. Have a good day.
Yeah,
you.
thanks to everyone.
Bye-bye.